Hi, friends. Let's discuss a very common clinical scenario we see in OPD. A 45-year-old male with newly diagnosed type 2 diabetes. His HbA1c is 9.4%. His BMI is 28.5 kilograms per meter squared. The big question is, what should be the preferred treatment? Many clinicians still start with one drug and then slowly escalate. But current guidelines are very clear. If the HbA1c is above 7.5%, start with two drugs. If the HbA1c is above 9%, start with three drugs. So in this patient, with an HbA1c of 9.4, triple therapy is recommended right from the start. Why not stepwise escalation? Because delaying adequate therapy leads to prolonged glucotoxicity, beta cell failure, and poor long-term outcomes. In a patient like this, without symptoms of hyperglycemia, a very practical and guideline-based option is triple oral therapy. My preferred cost-effective combination would be metformin, an SGLT2 inhibitor, and pioglitazone. Metformin addresses hepatic glucose output. SGLT2 inhibitors provide glucose lowering, weight benefit, and cardiorenal protection. Pioglitazone improves insulin sensitivity at the adipose tissue and muscles. Together, this combination targets multiple pathophysiological pathways of type 2 diabetes. We can simplify this using fixed-dose combinations to improve adherence. For example, metformin plus an SGLT2 inhibitor, such as 500 milligrams of metformin with 10 milligrams of SGLT2 inhibitor, can be given in the morning. Metformin plus pioglitazone, for example, 500 milligrams of metformin with 15 milligrams of pioglitazone, can be given in the evening. This provides effective triple therapy with just 2 tablets per day. Now, an important caveat. If this same patient had symptomatic hyperglycemia, such as polyuria, polydipsia, weight loss, or signs of catabolism, in that situation, insulin should be the preferred treatment up front, at least temporarily, to rapidly control glucose and reverse glucotoxicity. Once glucose control is achieved, we can then de-escalate to oral agents. So the take-home message is simple. In newly diagnosed type 2 diabetes, an HbA1c above 9% calls for early triple therapy. And if the patient is symptomatic, insulin should be preferred. If you found this helpful, don't forget to subscribe to Clinical Pearls for more practical, guideline-based tips that make everyday practice easier.